Hello, welcome to another episode of Arthritis and You, A Joint Journey. Today, we've got something special lined up, so buckle up because it's time for the deep dive. Let's give a warm welcome to our hosts, Arthur and Sarah.
Welcome back, everyone, to the deep dive. Today, we're going to be diving deep into the world of psoriatic arthritis.
Great topic.
It's something that a lot of you have requested we cover. We've got some excellent resources from the Alberta Rheumatology website.
Wonderful resource.
And yeah, our mission today is to really try to help everyone understand what this condition is all about.
Yeah.
And clear up any misconceptions and really just shed some light on how it's treated.
It's a condition that can really impact people's lives significantly, and it often gets missed or misdiagnosed.
One of the first things that jumped out at me when I was going through the material was that psoriatic arthritis is an autoimmune disease.
Mm-hmm.
I have to admit, before this, I kind of had it lumped in with, osteoarthritis. In my mind, I thought, it's just wear and tear on the joints.
It's a very common misconception, but it's totally different. It's not about aging joints. It's about your immune system actually attacking your own body.
Right.
Imagine your immune system as a guard dog that's trained to protect your house. But in psoriatic arthritis, that guard dog starts biting the furniture that it's supposed to be protecting.
Okay, that's a really good analogy to help understand it. So, and it's surprising to learn that it affects under 1% of the population.
Yeah.
Which, doesn't sound like a lot, but it's still a significant number of people.
It is. And what's even more fascinating is the link between psoriatic arthritis and psoriasis, the skin condition.
Right.
And in most cases, people actually develop psoriasis before they get psoriatic arthritis.
Wow. So they might be the first to notice those initial signs and symptoms then. So what are some things that people should be looking out for?
Well, the Alberta Rheumatology Association website highlights some common symptoms, including things like joint stiffness, particularly first thing in the morning, pain, swelling, and difficulty moving your joints through their normal range of motion.
Right.
They even give examples like struggling to turn a doorknob or even insert a key into a lock, which I thought was a great way to kind of illustrate the impact it can have on daily life.
Yeah, those are things we just completely take for granted.
We do.
Until you can't do them.
Absolutely.
And this isn't just limited to our hands, right?
No, it's not. So although the smaller joints in the hands and feet are often the first to be affected, any joint can be involved.
Really?
So wrists, elbows, shoulders, hips, knees, even the spine.
Wow.
So it's very important to detect this early.
Now, speaking of early detection, I noticed that the website mentioned something about eye diseases being linked to psoriatic arthritis.
Yeah.
That was something that kind of caught me off guard, I have to admit.
Yeah, it is a lesser known aspect of the condition.
Okay.
But psoriatic arthritis can lead to inflammation in the eyes, specifically conjunctivitis and iritis. So if you have psoriatic arthritis and you experience any eye discomfort or any changes in your vision, it's important to see an ophthalmologist promptly.
It seems like psoriatic arthritis can manifest itself in a lot of different ways, which must make it kind of challenging to diagnose. It makes you wonder how doctors distinguish it from other forms of arthritis, like rheumatoid arthritis, which also involves inflammation.
That's a great point, because they are both autoimmune conditions that cause inflammation in the joints. There are some key differences.
So what are some of the telltale signs that point towards psoriatic arthritis?
Well, one of the most significant clues, as we've already touched on, is the presence of skin and nail changes associated with psoriasis.
Right.
Another key distinction is the pattern of joint involvement.
Okay.
Psoriatic arthritis often affects what we call the distal joints.
Okay.
The ones closest to the fingertips and toes.
Distal joints.
Yes. And it can also involve the lower back, which is not typical of rheumatoid arthritis.
Okay.
And there's a distinct type of swelling we see often referred to as sausage digits, which is more common in psoriatic arthritis.
Yeah.
It involves the whole finger or toe becoming swollen rather than just the individual joints.
So I guess that visual alone could help doctors tell the difference between the two.
It can, but it's not always that straightforward.
Okay.
Another difference lies in how we diagnose them. While blood tests play a very important role in diagnosing rheumatoid arthritis, they're less definitive for psoriatic arthritis.
So how do doctors go about diagnosing psoriatic arthritis if blood tests aren't as reliable?
It really comes down to the rheumatologist's expertise. They take into account your medical history. They'll do a thorough physical exam and they'll carefully evaluate all your symptoms.
So it sounds like a good relationship with your rheumatologist is really important in cases of psoriatic arthritis.
Absolutely. Open communication and trust are essential.
Yeah.
This allows your rheumatologist to accurately assess your condition, track its progression, and tailor a treatment plan specifically for you.
It sounds like early and accurate diagnosis is really crucial,
Yeah.
especially since the website mentioned that psoriatic arthritis can actually cause damage to the bones around the joints if left untreated.
You're absolutely right. Early intervention is key. The goal is to diagnose and treat psoriatic arthritis early enough to prevent that kind of damage from occurring.
Like,
The sooner we can get the inflammation under control, the better the long-term outcome for the patient.
makes sense. So this makes me think about treatment options then.
Mhm.
What are some of the approaches that are available for managing psoriatic arthritis?
That's a great segue into the next part of our deep dive. We'll be exploring the different treatment strategies from medications to lifestyle modifications, and we'll delve into how those approaches can help people live well with psoriatic arthritis.
Sounds good.
Yeah.
Let's take a quick break and we'll be right back.
Sounds good.
Okay, so let's talk about treatment options for psoriatic arthritis. This is probably what a lot of people are really wondering about.
Yeah, understandable. A diagnosis can be pretty overwhelming, but knowing the options can really help you feel more in control.
Absolutely. So the Alberta Rheumatology website outlines a few different approaches, starting with NSAIDs.
Yeah,
Now, those are medications I'm at least familiar with for like everyday aches and pains.
right. NSAIDs, or non-steroidal anti-inflammatory drugs, are commonly used for headaches, muscle strains, and, arthritis.
Okay, so like ibuprofen and naproxen.
Exactly. Those are examples you might find right in your medicine cabinet.
Yep. So how do they work specifically for psoriatic arthritis, though?
Well, they help to reduce inflammation,
Okay.
which in turn eases the pain and the swelling in the joints.
Yep.
You can kind of think of it like dampening the fire, so to speak.
Right.
But not necessarily putting it out completely.
So they're good for managing symptoms, especially during flare-ups, I guess,
Exactly.
but not so much for addressing the root cause of the problem.
That's where another category of medications come in called DMARDs.
DMARDs.
Huh.
Those sound a little more serious.
They are, in a way, because they're designed to actually modify the disease course, not just mask the symptoms.
Right.
DMARD stands for disease-modifying anti-rheumatic drug.
Okay, so that means they actually try to change how the disease progresses,
Exactly.
not just cover up the pain.
Exactly. They work by suppressing the immune system's overactive response that's attacking the joints.
So it's kind of like going back to that guard dog analogy.
Yeah.
It's like retraining that overzealous guard dog.
Exactly.
Okay, I gotta admit, though, the term suppressing the immune system makes me a little nervous.
Yeah.
Aren't there risks involved with that?
It's a valid concern, but it's important to remember that rheumatologists carefully weigh the risks and benefits of DMARDs for each individual patient.
Okay.
They'll consider the severity of your disease, your overall health, and the potential side effects. And keep in mind that untreated psoriatic arthritis can actually lead to significant joint damage and disability.
Right. So it's about finding that right balance.
Absolutely. And there are actually different types of DMARDs, each with their own mechanism of action and potential side effects.
Okay.
Methotrexate, for example, is a very commonly prescribed DMARD that's been used for decades. And then there are newer biologics,
Okay.
which are genetically engineered proteins that target very specific components of the immune system.
So it sounds like the field of psoriatic arthritis treatment is always kind of evolving.
It really is. Yeah, researchers are constantly working to develop new and more effective therapies with fewer side effects.
That's great news. So besides NSAIDs and DMARDs, are there other treatment options available?
Yes, corticosteroids like prednisone are powerful anti-inflammatories that can provide short-term relief, especially during severe flare-ups. They can be taken orally or injected directly into the affected joint.
Right. I've heard those steroid injections can be really helpful for kind of that localized pain and inflammation.
Yeah.
But are there long-term things to consider with that?
Yeah, there can be. While they're very effective, corticosteroids do have potential side effects, especially with prolonged use.
Right.
So they're typically used strategically for shorter periods or in specific situations.
Okay, that makes sense. So you mentioned earlier that untreated psoriatic arthritis can lead to damage in the joints. Is that damage reversible?
Unfortunately, once joint damage occurs, it's often irreversible.
Cool.
That's why early diagnosis and aggressive treatment are so important to try to prevent or at least slow down that process.
Right. I imagine that can be tough to hear for a lot of people. So it makes you wonder if there are ways to manage the condition beyond just medication. Does the website mention anything about natural treatments?
They do acknowledge the growing interest in natural or complementary therapies, but they also emphasize that the scientific evidence to support their effectiveness for psoriatic arthritis is limited.
So it's a proceed with caution situation.
Yeah, exactly. It's really important to have open and honest conversations with your rheumatologist about any complementary therapies that you might be considering.
All right.
They can help you assess the potential benefits and risks and make sure that they won't interfere with your prescribed medications.
It sounds like that open communication with your doctor is really a key theme here.
It really is. Yeah. Building that trust and partnership is essential for managing a complex condition like psoriatic arthritis.
Now, I did notice the website mentioned a couple of natural approaches that seem to have some promise: omega-3 supplementation and exercise.
That's right. Omega-3 fatty acids found in fatty fish like salmon or in fish oil supplements have shown some anti-inflammatory properties.
Okay.
And while more research is needed, some studies suggest they might help to reduce joint pain and stiffness.
Yeah, I can see how making those part of your diet could be beneficial.
Yeah.
But exercise seems counterintuitive when you're dealing with painful, stiff joints. Is it really safe and effective for people with psoriatic arthritis?
The website actually emphasizes that regular exercise is not only safe, but it's highly beneficial for managing psoriatic arthritis.
Okay.
It helps to maintain joint flexibility and strength, which can be compromised by the condition. It can also reduce pain and improve your overall mood and well-being.
So it's not about like pushing yourself to the limit. It's about finding what works for you.
Exactly.
What kind of exercises are generally recommended?
Low-impact activities like walking, swimming, cycling are often good starting points. Strength training is also important for building muscle mass, which can help to support and protect the joints.
It sounds like there are a lot of options, and it's about finding what works best for each person.
Absolutely. It's about tailoring the approach to your individual needs and preferences.
Now, we've covered a lot of ground here: medications, natural therapies, the importance of exercise. But I'm curious, what can someone with psoriatic arthritis realistically expect in terms of their long-term prognosis?
That's a big question, and it's one that I think weighs on the minds of a lot of patients. The website acknowledges that older data suggested there was potential for disability and even a reduced lifespan for people with psoriatic arthritis.
Wow.
But they're very quick to point out that this was before the advent of many of the effective treatments that we have today.
So there's hope for a more positive outlook then.
Absolutely. With proper management and well-controlled disease, the outlook for individuals with psoriatic arthritis has drastically improved. Early diagnosis, effective treatment, and a healthy lifestyle can significantly minimize those risks and allow people to live full and active lives.
That's really encouraging to hear. It really highlights the importance of seeking care, staying informed, and being proactive about managing the condition.
Absolutely. Knowledge is power, and the more you understand about psoriatic arthritis, the better equipped you are to make informed decisions about your health and well-being.
Well, we've definitely covered a lot of information in this deep dive.
Yeah.
It's clear that psoriatic arthritis is a complex condition, but with the right approach, it can be effectively managed.
That's a really important takeaway, I think. It's not about letting psoriatic arthritis define you. It's about taking control and living your life to the fullest.
Well, as we wrap up our deep dive into psoriatic arthritis, what are some of the key takeaways you think our listeners should really remember?
I think first and foremost, just remembering that psoriatic arthritis is an autoimmune disease, not just wear and tear on the joints.
Right.
It's about the immune system mistakenly attacking the body, particularly the joints.
And that connection to psoriasis.
Yes.
That seems like a really big red flag.
Huge.
So if you've got psoriasis and you start experiencing joint pain, that's definitely something to talk to your doctor about.
Absolutely. Early detection is so important because it allows for timely intervention and can really help to prevent that irreversible joint damage down the road.
And we talked about how psoriatic arthritis, while it shares some similarities with rheumatoid arthritis, has its own unique characteristics and diagnostic process. I think it was really interesting to learn that blood tests, which are so helpful in diagnosing rheumatoid arthritis, are less definitive when it comes to psoriatic arthritis.
Yeah, it really highlights the importance of a thorough clinical evaluation by a rheumatologist who can really piece together all the clues.
Right.
The medical history, the physical exam, and the patterns of symptoms.
And thankfully, there's a whole range of treatment options available,
Yes.
from NSAIDs for kind of quick relief to DMARDs that can actually modify the course of the disease.
And it's not just about medication.
Right.
Lifestyle modifications, particularly incorporating those omega-3 fatty acids into your diet and engaging in regular low-impact exercise.
Yeah, I was really surprised to learn how important exercise can actually be for psoriatic arthritis.
Yeah.
But it makes sense. It's about maintaining that mobility and strength and just overall well-being.
Absolutely. It's not about pushing your limits, but finding a balance that works for you, whether it's gentle stretching, walking, swimming, or even strength training.
Right. It seems like having a proactive mindset and taking ownership of your health is so important when it comes to living well with this condition.
Couldn't agree more. It's about being informed, being your own advocate, and working in partnership with your healthcare team.
And resources like the Alberta Rheumatology website can be really valuable for gathering that information and staying up to date on the latest advancements in treatment and management.
Absolutely. I think they've done a fantastic job of presenting that complex information in a very clear and accessible way,
Yeah.
really empowering patients to actively participate in their healthcare journey.
Well, this deep dive has given me a much deeper understanding of psoriatic arthritis, and I hope it's done the same for you, our listener.
Yeah, it's a condition that deserves a lot more attention and awareness, and hopefully this conversation has helped to shed some light on its complexities and nuances.
We always like to end our deep dives with a thought-provoking question for our listeners to ponder. So knowing what you now know about psoriatic arthritis, how might you approach conversations about it differently, whether it's with your doctor or loved one, or even in online communities?
That's a great question to reflect on. I think the more we understand about psoriatic arthritis, the better equipped we are to share accurate information, dispel those misconceptions, and advocate for those living with the condition.
That's a perfect note to end on. Thank you so much for joining us on this deep dive into psoriatic arthritis. We hope you found it insightful and empowering. Until next time, keep exploring, keep learning, and keep the conversation going.
This has been another episode of Arthritis and You, A Joint Journey, brought to you by the Rheum team from albertarheumatology.com, your trusted evidence-based suite of resources available 24/7. Straight from Alberta, but for folks around the world. Our hosts today, Arthritis and Sarah Upis, technical producer, John Ifun, and our executive producer, Stephen Cates. While we work hard to maintain the accuracy of our information, we accept no legal responsibility for any errors or omissions. Remember, always check with your own physician first. Join us next time for another Deep Dive.